trainer. They will work with an athlete in observing and analyzing the areas that may have a problem, and then providing advice on how that athlete may be able to improve the performance. However, the trainer will not be the person changing the athlete. The athlete will have to change him or herself. The psychologist can also serve the function as a good mediator or arbitrator. So at times of family conflict, the therapist can also serve a wonderful role. Medical management can also be of help, and physicians can do one of two things. They can either prescribe medication or they can perform surgery. In the case of learning and developmental problems, sometimes medications can be of great help in addressing the symptoms that the children have. Finally, we look at environmental management, and we focus on home and school. And there has to be a lot of coordination and cooperation between those two environments for the child to be successful. So now that we have a general perspective of how to look at the whole child, let's look specifically at dyslexia. We're going to look at the historical perspective, a definition, and the neurobiology. Dyslexia was first described in 1877 when adults had brain injuries, and in spite of having normal sight, normal intelligence, and the ability to understand language, suddenly they could not recognize print. And at that point, Dr. Kussmaul labeled this disorder as word blindness. A few years later, Dr. Morgan recognized that children were born with similar difficulties, and for the first time it was recognized that what we call dyslexia today is occurred in children, and it was attributed to some type of neurological dysfunction. So from the very beginning we have known that children that have problems with dyslexia have had problems with neurological dysfunction. The word comes from the Greek, which means difficulty with words. Dyslexia is a disorder that is hereditary. It runs in families and is the result of neurological dysfunction. It is a chronic disorder. What that means is that it will not go away. The manifestations of this disorder are that we have individuals that present with difficulty with reading and with spelling, but their comprehension, particularly auditory comprehension, is significantly better than what would be expected for the reading abilities. The primary cause of this problem is a deficit in phonemic awareness. When we were talking about the processing of language, we talk about sounds being the most basic unit of language. Individuals with dyslexia have difficulty processing the sounds within the words. What we also know is that dyslexia is very often accompanied by other challenges. And that's why using the concept of the developmental web, looking at what are the contributing factors to the clinical presentation, besides the specific issues that may be causing reading difficulties, may indeed have a dramatic impact on how we manage this child. So again, the formal definition of dyslexia is one of several distinct learning disabilities that is neurobiological in origin. The symptoms of dyslexia include poor decoding and spelling abilities, poor accurate and or fluent word recognition, and these findings are not consistent with the child's age, cognitive ability, or educational experience. The cause of the problem is a deficit in phonological processing. It is unexpected because the child has been exposed to the same type of instruction as other children, and they have the developmental capacity to process the information. When a person presents with these difficulties, then they will have impairment in their reading comprehension, which may ultimately lead to poor vocabulary and general knowledge development. What dyslexia is not is a visual problem. It is a myth that children with dyslexia see letters or words backwards. We may see problems in children that have many types of different learning disabilities, present with problems with visual spatial organization and visual spatial orientation, but this is not exclusive of dyslexia. The primary problem with dyslexia is not a visual problem, it is a language-based problem. Dyslexia will not respond to standard classroom instruction. Dyslexia requires very explicit, sequential, and repetitive instruction. It is not a problem of the gifted. It is not the result of poor motivation, and it is not the result of lack of reading at home. A child that is not exposed to much reading at home may have a low vocabulary, but that does not mean that they would have problems with phonemic awareness. Dyslexia can present with very significant, it can affect very significant numbers in the population. These data from the National Assessment of Educational Progress here in the United States, they call it the Report Card on Education. These data from 2005 indicate that 38% of fourth graders read below basic levels. Actually, it was not proficient, it was basic levels. Right now that number is 34%, whereas 28% of eighth graders read below basic levels. So it's very significant. That would be below the 40th percentile. 20% of elementary school children in the United States are struggling with reading. If we look at the population of children with learning disabilities, 70 to 80% of the children are going to have a reading disability. We have talked about the National Assessment of Adult Literacy. We see that 5% of all adults in this country are non-literate, which is really the same number as children with severe reading disabilities. When you look at the scientific definition of dyslexia, which is the most severe of children with reading problems, we recognize that 5% of the general population have this kind of problems, and this number persists into adulthood. We have 21 to 23% of adults which are functionally illiterate. They could not read a book. And in this country, we have 25% of the adults that are illiterate are immigrants. English is a very complex language to learn to read. Unfortunately, individuals with dyslexia will drop out of school, and many of them will live under the poverty level. So the impacts of literacy in our population are very, very, very dramatic. The prevalence of dyslexia, as I said before, 80% of all of the learning disabilities are related to reading, which means that we would have more than 2 million children in this country, the United States, that would present with reading problems. We also see that about 1/4 of the children that have dyslexia would also have an attention deficit hyperactivity disorder, where we have 25 to 35% of children with an attention deficit hyperactivity disorder present with dyslexia. So these problems coexist with one another very often. So we know that 5% of the total population will have a very, very severe reading disability, and that 75% of the children with reading problems can be helped overcome their difficulties. Let's talk about the causes of dyslexia. What causes dyslexia? Well, we talked about before the problems with phonology. It's difficulty processing the sounds within the words. As we said before, a phoneme is the most basic unit of a language. Languages are made out of different sounds, and we combine those sounds into words. In the English language, we have approximately 42 phonemes, and that's what we consider a phonologically deep language. What we know is that deficits in phonology strongly correlate with reading problems, much better than the child's IQ early on. The phonologic system in the brain is in charge of processing and producing speech sounds. It is one of the earliest brain systems that developed. It is a natural system, it doesn't have to be taught, and is the whole foundation for language. Part of this system will be dependent on multiple factors. We talked about different aspects of memory, phonological memory, the capacity